There's this almost universal moment in parenting. It's usually around day 3. The adrenaline's worn off, the house is quiet, and you're just staring at this tiny human in the bassinet.
The "is this thing working" phase.
Exactly. You're marveling. And then, out of that complete silence, a chew.
Ah, yes.
Yeah.
Sound that launches 1,000 anxieties.
1,000 is right, and then maybe another one, and your brain just lights up. It's immediate.
Oh, I know it so well. It's that instant jolt of adrenaline.
And the monologue starts, or, oh no, is that a cold? Is it dusty in here? Did I leave a window open? It's this huge spike of worry over the tiniest little sound.
It is. And, it's a totally valid reaction. We're wired to protect them.
Yeah.
In our world, an adult world, a sneeze is a signal. It's a red flag for sickness.
Or if I sneeze like that, I'm already thinking about canceling plans for the weekend.
Precisely. But the fascinating thing we're going to get into today, looking at these medical guides on newborn respiratory adjustment, is that our adult logic is, well, it's completely backwards here. For a newborn, that sneeze isn't a sign that something's broken. It's actually proof that the system is working exactly as it should be.
Okay, that is a bold claim. So the mission for this deep dive is clear then. We want to take you, the listener, from being a symptom watcher.
Hovering over the crib, counting every sneeze.
Yes. From that to really understanding what is basically a sophisticated biological system check.
That's the goal. And if there's one headline to take away from our sources today, it's this. Newborn sneezing is frequent, it's almost always normal, and the medical literature calls it a protective reflex. It's a feature, not a bug.
I love that framing, a feature, not a bug. But to really believe that, because it's hard to ignore a sneeze, we have to understand the context. These babies, they've just gone through a massive scenery change.
Scenery change is, putting it very lightly, it's maybe the most dramatic physical transition a human ever goes through. We have to talk about the womb-to-world journey.
Let's set that scene, because we forget where they just came from.
Okay, so picture the womb. It's warm, it's dark, but the crucial thing is, it's aquatic. It's a completely fluid-filled space. The baby is literally swimming.
And their lungs, they aren't breathing air in there.
Not at all. The respiratory system is on standby. The lungs are full of fluid. They get all their oxygen, get rid of all their carbon dioxide through the placenta.
Yeah.
They're basically underwater divers with an external air supply.
So that's the norm for 9 months, water creatures. And then in just a few minutes, that's all over.
It is terminated immediately. They're born, and suddenly they're in a dry environment. The air is colder. There are particles everywhere. And they have to switch from placenta breathing to lung breathing instantly.
That's a massive physiological shock.
It is a huge shock. And this is where the sneezing comes in. You have to remember that fluid from the womb doesn't just, magically vanish.
Right. It doesn't just evaporate when they hit the air.
No. There's often some residual amniotic fluid, bit of mucus, still sitting in the nasal passages and the upper airways. And the body has a very urgent problem. I need air, but there's sludge in the pipes.
So the sneeze is the cleanup crew.
That's a great way to put it. It's a mechanical ejection system. It's the body's way of forcibly clearing everything out. It's saying, get this fluid out of here so oxygen can get in. So that sneeze is the first few days. That's not sickness. That's housekeeping.
Okay, that makes perfect sense for the first few days. I can wrap my head around that. But what about 2 or 3 weeks later? The amniotic fluid has to be gone by then, right? Why are they still sneezing?
And that brings us to anatomy. This is something we really, really underestimate. The sheer scale, or really the lack of scale, of a newborn's nose.
It's tiny. It's a little button.
It's incredibly small. But it's not just the outside. The internal passages are microscopic. The medical texts all describe them as having extremely narrow nasal passages. And I have to pair that with another fact. Newborns are obligate nose breathers.
Obligate nose breathers. Okay, what does that mean in simple terms?
It means they have a very strong preference for breathing through their noses. They don't have that reflex we do to just switch to mouth breathing if they get stuffy. For them, the nose is the main intake valve.
So stakes are high?
Incredibly high. If that nose gets blocked, they're in trouble. So the body defends it aggressively.
Give me a comparison, like for the size.
Okay, so think of your own nasal passage as a big, wide hallway. If there's a tiny speck of dust in there, it's like a single chair in that hallway. You can easily walk around it. You might not even notice.
Okay, I'm with you. A chair in a hallway, no big deal.
For a newborn, that hallway is more like a narrow drinking straw. So that same speck of dust isn't a chair anymore. It's a boulder blocking the entire tunnel.
Because the diameter is so small.
Exactly. The margin for error is basically zero. And on top of that, the lining of that nose is brand new. It's hypersensitive. It hasn't been dulled by years of breathing city air and perfumes like ours has.
So it's a hair trigger system.
It has to be. Because they rely on that nose, they can't afford a blockage. So the brain just sets the sensitivity dial to 11. The tiniest piece of lint can trigger this huge get it out response.
That actually makes me feel so much better. It's not that they're sick, it's that their security system is just incredibly strict.
Top-tier security clearance, nothing gets past the guards.
So we've got the anatomy, but the sources list some triggers that honestly surprised me. I think we all assume it's just dust or maybe a virus, but there are these everyday things that set it off.
This is where that symptom watcher mindset gets us into trouble. We look for the bad triggers, but the normal life triggers are way more common. Let's take feeding, for example.
This one was strange to me. The sources say babies often sneeze after a feeding. And my first thought is, are they allergic to the formula? Is it the milk?
That is the #1 worry. But usually, no, it's physics again. Just think about the proximity of everything. You've got the breast or the bottle right up against this tiny sensitive nose.
Right, it's all kind of smushed in there.
And sometimes a tiny droplet of milk gets near the nostril. Or even just the humidity and the strong smell can stimulate that sensitive lining. It's just sensory overload.
So it's just too much input at once.
Too much input. And you have to remember, they're learning to coordinate sucking, swallowing, and breathing all at the same time. It's a complex dance. If they mistime it even slightly, the sneeze is the reset button. It clears the airway.
So milk nose is a real phenomenon.
It is. They eat, they're full, they sneeze. It's almost a ritual. And then there's temperature. This is a huge one people miss.
You mean like taking them outside into the cold?
Doesn't even have to be that dramatic.
Or just
moving from a warm bath to a cooler hallway. Or the classic one.
a diaper change.
Oh, the 3 a.m. diaper change. Always a fun time.
You unzip the swaddle, cool air hits their skin. The sources explain that because their nervous system is so immature, a sudden temperature shock on their body can actually trigger a sneeze reflex. It's like a whole body reboot.
That explains a morning sneeze then. I saw that in the notes. The system boot up, yeah. It's a mix of things. They start moving around, their heart rate changes, they're reacting to the light, which is a real thing, by the way, the photic sneeze reflex. And they need to clear out any mucus that settle overnight. So they sneeze to open up the airways for the day.
System boot up. I really like that. It reinforces this whole idea that the sneeze is a reaction to the outside world, not an attack from an inside virus.
That is the aha moment.
Yeah.
These triggers, milk, temperature changes, dry air, light, that's the baby interacting with their new environment. Our worry is about internal pathogens, but for those first few weeks, most sneezing is just the baby meeting the world and the world being a little bit irritating.
Okay, so if this is all just normal adjustment, there has to be a timeline, right? A point where it eases up. Parents can handle anything if they know it's a phase.
The sources are pretty clear on the timeline. Sneezing is described as quite often in the first few weeks. It's a defining feature of being a newborn. If your baby is under a month old, you should just expect daily sneezing. That's peak adjustment time. Then you see a pretty significant drop-off around the 2 to 3 month mark.
What's so magical about 3 months? Do they just get used to everything?
It's not magic, it's just growth. But it's two specific things. First, their face physically grows. Those nasal passages, the straws we talked about, they get wider. They become more like that hallway.
So a speck of dust isn't a boulder anymore.
Exactly. It's just a speck. It doesn't trigger the big explosion. And the second thing is neurological. The newborn's nerves are kind of uninsulated. Signals can jump the tracks. By 3 months, that control over breathing just gets more coordinated. They stop misfiring.
So if I'm holding a 6-week-old who's sneezing like crazy, the takeaway is
just patience. It's respiratory adjustment in real time. It's temporary. You're just in the thick of it.
But even with all this logic, that fear of the cold is so powerful. We need to do some serious myth busting here. Because even knowing this, I hear a sneeze, I think germs.
We have to decouple those two ideas. The biggest myth is simply that a sneeze equals a cold. The sources state it very clearly. Unlike a toddler, sneezing in a newborn rarely means they have a cold.
That just feels counterintuitive. Why wouldn't it be a cold?
Well, 2 reasons. First is just exposure. Unless you have older kids bringing germs home, newborns are usually pretty isolated. But second, and more importantly, is maternal immunity. They get a whole bunch of antibodies from their mother during pregnancy that gives them a kind of borrowed shield for this exact period.
That's a relief. But what about the other big one, allergies? I feel like every parent asks, is my baby allergic to the cat?
The cat panic, yes. The sources are very firm here. True environmental allergies like hay fever or pet dander are extremely uncommon in newborns.
Really? I would have thought they'd be the most sensitive.
No, because an allergy is a learned immune response. The body's immune system needs time and exposure to develop that kind of reaction. A 2-week-old baby just hasn't been alive long enough to develop a complex allergy to the cat.
So I don't need to get rid of the cat.
Not because of the sneezing, no. The cat is safe.
Okay, last myth. The block nose panic. A parent hears a snuffle, sees a sneeze, and they're convinced the baby can't breathe.
The blockage myth, yeah.
Yeah.
Parents think the nose is blocked solid, but usually it's just noisy breathing. Newborns are noisy creatures. They gurgle, they snort, they make these little whistling sounds.
They can sound like little pugs sometimes.
They really do. And that's just because of that narrow airway again. Air moving through a tight space creates turbulence, and turbulence creates noise. The rule of thumb is, if the baby is breathing comfortably otherwise and eating fine, that noise is just acoustics. It's not a true blockage.
Okay, so we've done the why and the when. Now for the what do we do part, because your instinct is to fix it. You want to do something. But the practical advice here is, well, it's tough for anxious parents.
The do-nothing approach.
Which is the hardest thing to do. I want to tinker.
It's excruciating. You want to help. But the sources are clear. Most of the time, you don't need to do anything. You don't need to fix a reflex that's already working correctly. Let the sneeze do its job.
But there are some things we can do, right, environmentally. If dry air is a trigger, can we fix the air?
Yes, you can optimize the environment. We know they came from a fluid world, so maintaining comfortable humidity can be a huge help. A cool mist humidifier can really soothe that sensitive nasal lining.
Kind of recreating the womb a little bit.
You're just softening the landing and obviously keeping the air clean, dust-free, smoke-free. And here's one people overlook. Avoid strong perfumes, scented lotions, even heavily scented detergents.
Oh, that's interesting. So my cologne could be the problem.
It could be. Remember how sensitive that lining is? To a newborn nose, a strong floral perfume is like breathing in pepper spray. Going fragrance-free can actually reduce sneezing a lot.
I have to ask about the saline drops. Every parent gets sent home with saline, that little blue bulb syringe. The temptation to use it every single time they sneeze it's huge.
Step away from the bulb syringe.
Why? It feels like I'm helping.
The sources are so specific about this. Routine saline drops and suctioning are not needed for normal sneezing, and you could actually be making it worse.
Worse? How?
Think about it. The nasal lining is already sensitive and maybe a little irritated. If you stick a plastic syringe up there, you just irritate it more. You can cause more inflammation, more swelling. You might actually trigger more sneezing because the nose feels attacked.
That's a vicious cycle, so when do we use it?
Only when the nose is actually blocked to the point where it's affecting their ability to eat. If the baby keeps unlatching from the breast or bottle to gasp for air, that's when you use saline. But for a simple sneeze, let the sneeze do the work.
And wiping. Can I at least wipe their nose?
The visible only rule. If you see mucus coming out, gently wipe it with a soft cloth. If you can't see it, don't go digging for it.
Don't go digging. Solid life advice. So instead of focusing on the sneeze, the sources suggest this wellness check, a way to shift your focus to the whole baby.
Right. This is your sanity saver. If you're worried, stop counting sneezes and ask yourself 4 questions. 1. Is the baby feeding well?
Okay. Taking their normal amount, not struggling.
Exactly. 2. Is their breathing normal? Meaning, is the rate steady? Are they not gasping? 3. Are they active and alert between feeds? And 4. Are they sleeping comfortably?
And if the answer to all of those is yes,
Then the sneezing is harmless. You can relax. Your baby is just doing routine maintenance.
that is a fantastic mental checklist.
Yeah.
But we have to talk about the red flags, because sometimes a sneeze is part of a larger problem. We can't tell people to ignore everything.
Absolutely. Context is everything. A sneeze only becomes concerning if it's accompanied by other specific symptoms.
Hmm.
We're looking at the whole clinical picture.
So what are the specific warning signs? What should make a parent pick up the phone?
The first and most critical one is any difficulty breathing. And we need to be clear what that looks like. We're talking about retractions.
Retractions. Paint me a picture.
It's when the baby is working so hard to breathe that you can see the skin sucking in between their ribs or at the base of their neck. It looks like their chest is collapsing inward with each breath.
Okay, that is a scary visual. That's not subtle.
It's not. Or nasal flaring, where the nostrils flare out wide with every breath. If you see that, sneeze or no sneeze, that's an emergency. You call a doctor immediately.
Got it. Breathing effort is everything.
Then you have poor feeding. A baby who's too sick or too congested to eat needs help. A fever, which in a newborn is anything over 100.4 Fahrenheit or 38 Celsius, is always a major red flag.
What about the mucus itself? You said clear stuff is normal.
Generally, yes, clear or whitish mucus is fine. You start to worry if it becomes thick, yellow, or green. That suggests an infection might be setting in.
Okay, so color matters. Clear's clear, green is mean.
I like that. And finally, a persistent cough or any kind of bluish color around the lips. Those are signs of oxygen issues.
The sources mention that pediatricians kind of feel like they're speaking a different language than parents on this. The parent comes in worried about the sneeze count.
And the doctor's looking at something else entirely. Yeah. There was a note that said, while parents are counting sneezes, the doctor is assessing the work of breathing. The doctor doesn't care if the baby sneezed 10 times. They care if the baby is pink, well oxygenated, and gaining weight.
It really sounds like we have to retrain our brains. We see a sneeze and we think weakness, but the baby's actually saying, I've got this handled.
That's it exactly. The sneeze is a sign of competence.
So, to wrap this all up, we've gone from the fluid-filled world of the womb to the dry, dusty air of the nursery. We've learned that the newborn nose is this tiny, high-security system that reacts to everything.
From milk to a change in temperature. And we've learned the sneeze is the body's primary tool to keep that airway clear. It's a sign of a working system, not a broken one.
And we've busted the myths about colds and allergies and learned that unless those red flags are there, the retractions, the fever, the green stuff, we can pretty much just let them sneeze it out.
Exactly. It prevents so much unnecessary worry. Instead of panicking, you can just observe them and think, good job clearing out your airway.
Which brings us to our final thought. We always like to leave you with something to think about, and for me, this deep dive really changed how I see a newborn.
How so?
Well, we think of them as totally helpless, right? And in so many ways they are. They can't hold up their own head, they can't feed themselves. But this sneeze, it's actually kind of profound.
If you connect it to the bigger picture, it really is. I
Yeah.
mean, think about it. Inside the womb, the mother's body did everything for them. It provided oxygen, it removed waste.
Yeah.
The baby was just a passenger.
Right.
But the moment they're born, they're on their own, respiratory-wise. They have to drive the car themselves. That first sneeze, it isn't a problem. It's the baby's first independent act of survival. It's them keeping their own airways safe without your help.
I love that. It's a tiny, noisy milestone of independence.
It is. It's them saying, don't worry, I got this.
Something to think about the next time you hear that little achoo at 3 a.m. Instead of reaching for the thermometer, maybe just give them a little mental high five. That's all for this deep dive. Thanks for listening.